Now, adolescence is a high-risk time for developing eating disorders, and the pandemic resulted in even more children and young people having to seek help.
From today, though, nurses in schools across England will receive what's being called a toolkit to help them offer support and spot early warning signs. Tim Muffet explains.
Hello.
Life is good for Katie.
How's it going?
But 10 years ago, when she was 14, it began to feel bleak and overwhelming.
I developed an eating disorder in around 2012 and I began kind of restricting my food. I was very, very good at kind of masking it and hiding it.
How bad did things get for you?
Pretty bad. So weight loss, I lost my periods for a good few years. I did not really have much concern for my own safety and didn't really appreciate my own mortality. And looking back, there are several occasions where I very well could have died.
Years of treatment and support have helped Katie overcome her eating disorder. Today, the UK's first eating disorder manifesto is being launched to try and remove the stigma and misunderstanding that can surround the condition. It'll include a toolkit for school nurses to help them and other staff support pupils.
Could it have helped you when you were younger?
I think so, yes. I know a lot of my teachers probably did really care and were concerned, but didn't really know what to do. And in my head at the time, I was thinking, oh, well, no one's even noticing, like, no one cares. I obviously don't look ill enough.
During the pandemic, many people said that, perhaps unsurprisingly, they felt more anxious or isolated than normal. But it seems that COVID has also had a specific impact on eating disorders. Between March 2020 and March 2022, the number of children and young people in England waiting to start NHS treatment for eating disorders rose by almost 3.5 times.
Fear and lack of control and all those kind of things can lead to eating disorder behaviours, and I think it was a very uncertain and fearful world we were living in. A hallmark of eating disorders is deception, and it's much more difficult to deceive people when you are with them 24/7. So I think that could also have been why more cases were detected.
The government says that last year it provided an extra £79 million to expand children's mental health services, including access for at least 2,000 more children and young people to eating disorder support. Katie now has a wholehearted appetite for life. She just wants others with eating disorders to experience the joy she once feared would never return. Tim Muffet, BBC News.
Well, to talk about this in a little more detail, we're joined now by Sharon White, who's a school nurse, and also by campaigner Hope Virgo. Morning to you both. Hope, if I can come to you first. Why is this toolkit so badly needed in schools at the moment?
Yeah, so we have seen a huge rise in the number of people struggling with eating disorders, and whilst we're seeing this in adults as well, we are seeing huge numbers in children as well. And we know that currently schools, and particularly school nurses, are having to often pick up the pieces around treatment, around support, because there is just not enough services out there for people to be accessing it. And so the toolkit is going to help empower school nurses, but also schools, to talk about it, to get in there early for a young person who's struggling with an eating disorder, and then we can focus a lot more on the early intervention and prevent, hopefully, that individual escalating to needing that full-on hospital treatment.
We have a school nurse here. Let's talk to Sharon. Morning to you. What kind of issues are you seeing and how will this help?
Sure. Well, we already had a problem pre-COVID, but since COVID we've seen an exponential rise in all mental health issues in children and young people, eating disorders being one of them. And so we are overwhelmed seeing the number of young people coming forward, or school staff referring them, parents reaching out for help, and young people themselves self-presenting, asking for help.
Overwhelmed?
Yes, I mean, that's set against a loss of 30% of a school nursing workforce over the past 5 years.
And what was it particularly about the pandemic that is now giving children and young people a problem?
I guess being locked in, locked up, locked down, so loss of that social interaction, loss of spaces to play, loss of space for sport, loss of friendships, loss of that wider support in schools. So lots and lots of the issues that lots of us experienced, but totally unnatural for our children and young people.
Hope, that's such a worry, isn't it? And there'll be so many families this morning with kids who've been through all this and are going through it at the moment. I mean, what would your tip be to any parents based on the toolkit you've put together?
So I think for me, it's about just getting people to have that conversation. I think so often with eating disorders, we're afraid of getting it wrong or triggering someone, and we need to not shy away from these conversations. I think particularly with eating disorders, there is a huge amount of stigma out there still. We still often think of it as an illness that only affects white, teenage, underweight girls, but actually we know that eating disorders affect people of all different body sizes. So if you think in your gut that something is going on for your young person, your loved one, or even yourself if you're watching this, have that conversation. Start opening up like that. And in all of it, I think just remembering that eating disorders aren't about food. They present themselves in that way, but they're because something is going on for that person. So taking the time to actually understand what that might be.
And Hope, it's such a good point, isn't it? Start the conversation. I think many parents, even teachers, friends, might not know what to say.
Yeah, and I think that's the hard thing. We often don't. So my thing is to initially start by having that direct conversation. So maybe ask them about their behaviours, ask them what's going on, knowing that there'll be about 90% of people who will shut you down and say they're fine, life's fine, everything's fine. I definitely did that from my own experience. But then going back to them a couple of weeks later and asking kind of, how are you feeling? What can I do to support you? And slowly but surely kind of being patient, not being judgmental. And I think a really big thing just in light, obviously we've talked about the pandemic, but Sharon obviously mentioned that we had eating disorders before the pandemic. I think at the moment we're making this assumption that everyone's got an eating disorder because of the pandemic, but actually don't assume that's the reason. There could be something else going for that person that's completely unrelated to the pandemic.
Hope, you talked about your own experience. How has that informed you, the way you've put together this information for schools?
Yeah, so I guess firstly, we put this together with a group of experts. So we had school nurses, we had other people with lived experience, and we had carers as well. So we've tried to cover the kind of whole bandwidth of people who need to access this and who will get that support. For me, the main thing with eating disorders is, like I've touched on the stigma already, but that whole misunderstanding around eating disorders. And I'm hopeful that in the toolkit, that actually gets across. I think also for me, in the toolkit, emphasising to not shy away from those conversations, to empower people to get talking and to actually always have a plan in place for that person. For me, I remember I used to think that people only thought there was the problem when I looked physically unwell. And actually eating disorders aren't about that. So yeah, getting that across for me was crucial.
And Sharon, what should people be looking out for? What types of behaviour, what signs? As Hope was saying, it's maybe not always about weight loss.
Absolutely, and we've got to move away from that. Changes in behaviour, there might be issues around meal times, there might be issues around sports and activities, a change in personality, perhaps homework dropping off, perhaps social life dropping off, just being a little bit different. And I think we need to be professionally curious. I don't want to put more onto our school staff's shoulders because obviously they are supporting these children a lot longer than school nurses, but we do need to pick up on those signs. So within the toolkit, we've also developed a resource for schools for education as well, which goes through some of the signs to look out for and also helps us to articulate those very difficult questions that Hope was talking about.
I guess the challenge in schools, in families, is that some of the kind of things we're talking about, sort of behavioural changes, not doing homework, aren't necessarily symptoms of an eating disorder. So it's how do you know when that is the problem?
Yeah. It's a $6 million question, isn't it? And, you know, it's about having good relationships. It's about having those open and honest conversations. It's about schools ensuring it's within the curriculum so that the children have got the literacy, they've got the words, and that they begin to recognise some of the symptoms they may be experiencing.
And kids can sometimes hide, can't they, the reality of what's going on in their lives. That they can be quite deceptive. They can, yeah,
I guess deceptive is quite a strong term, but I totally understand. And I think, you know, a lot of young people with eating disorders, because of the shame and the guilt and the stigma, embarrassment, they become very good at hiding it. And that's for school nurses, for the support networks and for schools to try and help them open up about that. It's not easy at all.
And Hope, just a final word from you. How would this toolkit have helped you in your younger years?
It would have definitely given the school nurses, but also the school more broadly, the skills to actually talk about eating disorders to me. I hid my illness for about 4 years before anyone intervened, and it resulted in a year-long hospital admission. And I'm not the only person that will have happened to, but obviously at the moment, because of services, access to treatment's even harder, so people are functioning with eating disorders really, really struggling. So I think for me, it would have given that kind of early intervention, hopefully the conversations around that, but also a really big thing within the toolkit is providing that hope that people can fully recover. Yes, eating disorders are very serious mental illnesses, but don't lose hope that you can't recover. And for me, seeing that in the toolkit and someone telling me that would have been really, really key to keeping me motivated and to keeping me focused on that end goal.
Hope, offering hope on BBC Breakfast for us this morning. Thank you very much indeed. Good to see you, and thanks for sharing and joining with us, Sharon, as well. Thank you so much.
Thank you very much.
And if you've been affected by any of the issues raised, you can find help and support at bbc.co.uk/action line.
Coming up to 8:30, let's get the news, the travel and weather from our teams around the UK. We'll see you in a sec.